Thank you very much, and giving us the opportunity to be here today to present our initiative on the economics of pandemic preparedness. Imagine the Spanish flu would break out in Singapore tomorrow. Do you want to know what would happen? The disease might be seeded by a traveler who arrives at Changi Airport. The first cases remain undetected. But luckily, Singapore is very well prepared for a pandemic. They have excellent disease surveillance, laboratory systems, test and trace systems, and treatment facilities that can be scaled very quickly. Once the first patients arrive in hospital, Singapore closes the borders, locks down schools and businesses. Soon, the schools and businesses can be reopened, but the borders remain closed. Vaccines are developed at scale. In year 2, vaccine rollout can start. And then eventually, the borders can be reopened. This is not fiction. This is an actual simulation that my team at Imperial College London modeled with real data from Singapore and with real data from the Spanish flu. The model also calculated and projected that around 22% of annual GDP for Singapore would be lost in this scenario. This consists of the monetized lost lives, so deaths that are valued in monetary terms, business closures, the costs of keeping schools closed, and the lost education for generations to come. So this is the happy scenario. But now imagine Singapore would not have been as well prepared. This would have been the outcome. We would have seen hospital capacity indicated by the dashed line be breached 2 times, patients being sent away from hospital. We would see 3 lockdowns indicated by the yellow bars. And we would see many, many lost lives. When valued in monetary terms and taken together with the cost of lost business because of sick employees, this would amount to over 200% of annual GDP. Now, clearly, comparing these 2 scenarios, it is obvious that for Singapore, it makes sense to invest in pandemic preparedness. The return on investment is positive. Massive burden is prevented by investing. However, is the return always positive? Would it have been worthwhile to invest if there was a pathogen that is not as severe as a Spanish flu? Would this hold for all countries in the world? Currently, we do not know. That's why we need research into the economics of pandemic preparedness. The Jameel Institute at Imperial College London got together with the Singapore's Program for Research into Epidemic Preparedness and Response and the National Center for Infectious Diseases. We aim to forge the world's first initiative on the economics of pandemic preparedness. Our mission is to develop sophisticated, integrated economic epidemiological models, and with these models we can project the deaths, the economic and social costs of hypothetical future pandemics under alternative preparedness scenarios. So what are our deliverables? We have 4. The first one is an online dashboard free to the world where every user can project scenarios such as the one you have seen now for over 150 countries in the world. We will also develop the science behind this, building on our existing integrated model that we have developed for the COVID-19 pandemic. We will work closely with our partners in governments and international organizations to work in 5 countries on deep dive selected issues that are of concern to these partners and to these countries. And lastly, we will provide capacity training to train the next generation of modelers that are equipped to use and develop further these complex and sophisticated models. Pandemics force us to make tough choices between health and the economy, between lives and livelihoods. With our research, we want to empower countries to make optimal choices for the benefit of populations around the world. Thank you very much.
Very much.
I now want to call to the stage actually Peter Colvin, who is the COO of APAC Citadel. Peter.
Can you hear me? Thank you. Thank you, Professor Hauck, for the kind introduction, and thank you to all our partners and the Jameel Institute at Imperial College London, the National Centre for Infectious Diseases, Programme for Research and Epidemic Preparedness and Response, Prepare, in Singapore, and Community Jameel, and their director, George Riches, who joins us here today, and the many others who are joining with us to make this work possible. A sincere thank you to the team at Temasek and the Temasek Foundation, the Philanthropy Summit Asia team, and the Government of Singapore for hosting this important and inspiring convening. Today, I'm pleased to represent Citadel founder and CEO Ken Griffin, who's joined together with the Community Jameel to support the launch of this new global initiative on pandemic preparedness. COVID-19 has laid bare the threat that infectious diseases pose, and it's clear that we can't let this pandemic pass before we prepare for the next one. To quote the DPM, we must not sleepwalk. By better integrating economic and epidemiologic modeling, our hope is that Jameel Institute Kenneth C. Griffin Initiative for the Economic Pandemic Preparedness will equip policymakers and public health officials with the evidence they need to reduce further threats, protect livelihoods, and ultimately save lives. Ken wishes he could be here today and is honored to join with this world-class, renowned group of researchers and policymakers to launch this effort and to help save lives and livelihoods during the next pandemic. We hope many of you will join us with this work, and thank you very much.
Good afternoon, everybody. So I'm here to share with everybody the SingHealth Duke-NUS Maternal and Child Health Research Institute's proposal entitled Genomics for Kids in Asean. So at the SingHealth Duke-NUS Maternal and Child Health Research Institute, or better known as MCHRI, we take a life course approach and we look at this critical life cycle of the mother and child and the family. The mother brings up a child with the family, the child grows up, early childhood, becomes an adolescent and an adult. And we want to continue to enrich this important life cycle. We want them to be born well, we want them to keep well, and to continue to get well. So we were set up and launched in October last year, and our key aim is to build a more resilient community and to maximize human potential as a nation. And we want to lay the foundations for the transformation of our nation's future. And as I mentioned, we take a life course approach to this, and this is very crucial as we move forward as a nation. And we want to be Asia's center of excellence for maternal and child health and bring together all the partners in this region and internationally to achieve this. These are our 4 key domains and 6 platforms. And the 4 key domains are preconception and reproductive health, metabolic health, neuro, cognitive, and developmental and mental health, and critical and serious conditions in children. And our key 6 platforms are genomics, immunomics, nutrition, a life course analysis, epidemiology, and a life course and a health services research, leveraging on medtech and informatics, as well as having a family and community integration in this approach. And what we want to do is to continue to build an integrated system and to learn from this and develop this as a community and learn together. So MCHRI's Genomics for Kids in ASEAN comprises of these elements. Firstly, it is estimated that there's 1 in 20 babies. They are born with what so-called rare diseases, and in the ASEAN community of 660 million, that translates to 10 million children. And what we want to do is to improve the access and to build up the capability in our ASEAN community to be able to identify these genetic conditions at a timely manner. Early diagnosis leads to optimized treatment and management. It helps to reduce resource utilization because if we identify them early, prevention and treatment is better than subsequent management and care. It also allows us to better understand the genomic profile in our community in ASEAN and build a learning registry for this, and also discover new syndromes that can be treated. What we want to do is to improve the diagnostics, discovery, and therapeutics with the power of genomics, and work together with everybody in the ASEAN community to build this. And we're starting off with impacting more than 700 children, which actually translates to about more than 2,000 people, because it's the child, the father, and the mother. And we had a small project in Singapore called Bridges, and that has actually resulted in diagnosing 40%. 40% of them actually eventually had a diagnosis and were able to be managed and treated more in a more precise way. So we ask everybody here in this room to join with us in this endeavor, this Genomics for Kids in ASEAN program. Genes are the building blocks of our human capital. And as Ms. Joyce Banda, the former president of Malawi, once said, the seeds of success in every nation on earth are best planted in women and children. We want to continue securing healthy outcomes and optimizing potential for everybody in this world. This is my email. Thank you very much.